virus for 14 days. Ganciclovir may be used in a case of cytomegalovirus or cytomegaloviral encephalitis. The third type of CNS infectious diseases is the brain abscess. Brain abscess is a localized form of infections and inflammations of the brain caused by pathogenic organisms. The organism may reach the brain either by direct spread from a nearby infected site, such as otitis media and sinusitis, or reach the brain via the hematogenous spread, particularly from the chest in a case of lung abscess. The pathology of the brain abscess, any of the pathogenic organisms may be responsible, and the developing abscess passes through three stages. Number one, acute encephalitis. Number two, the pus formation that occur as a result of the liquefactive necrosis that occurs at the center of the inflamed and the infected area of the brain. The third stage in the pathogenesis of the brain abscess is the capsule formation around the inflamed area. The site of the brain abscess is variable in the brain according to the origins of the infections. For example, if the infections comes to the brain from sinusitis, the brain abscess is usually present in the frontal lobe. If the organism comes to the brain from the ear, in a case of otitis media, the abscess is usually present in the temporal lobe or in the cerebellum. But when the organisms reach the brain through the hematogenous spread of the organism, the abscess is usually present in the supratentorial regions and is usually multiple abscesses. The manifestations of the brain abscess could be classified into three groups. The first group of manifestations are the general manifestations of infection, such as pyrexia and leukocytosis. Number two, manifestations of increased intracranial pressure, such as headache, blurring of vision, vomiting, and disturbed conscious level. The third group of manifestations are the focal manifestations depending upon the site of the abscess. For example, if the brain abscess presents in the frontal lobe, we may find personal and behavioral changes. If the abscess present in the temporal lobe, we may find memory impairment, cognitive impairment, temporal lobe epileptic seizures. If the abscess is related to the motor area, we may find in the patient's hemiparesis or hemiplegia. If it is related to the speech center, the patient may be presented with aphasia and so on. Different clinical manifestations related to the site of the brain abscess. The investigations used for the diagnosis of the brain abscess is the neuroimaging of the brain, including the brain CT with contrast or MRI brain with contrast. It may show focal lesions in the affected site. If there is a liquefactive necrosis that occurs inside the abscess, we may find a fluid level in the lesions. If we inject the contrast materials, we will find ring enhancement around the lesion. What about the prognosis of the brain abscess? Untreated cases usually end fatally. Untreated cases of the brain abscess is fatal. Treated cases usually recover, but epileptic fits or residual neurological deficit, such as hemiparesis, may occur depending upon the site of the brain abscess. This is an example of CT brain and MRI brain with contrast for a patient with brain abscess. This is the brain abscess, and this is the hyper intense lesion around the abscess that's called ring enhancement. This is the contrast material present in the capsule around the abscess that's called ring enhancement. Treatment of brain abscess is surgical treatment. The brain abscess may be acute or chronic. In a case of acute brain abscess, there is a preoperative medical treatment followed by surgical treatment. The preoperative treatment for at least 2 weeks to allow capsule formations. Such a treatment consists of penicillin intravenous in a dose similar to that of meningitis, 4 million units every 4 hours intravenous daily. Then after the capsule formations, surgical removal of the abscess is performed. In a cases of chronic abscess, surgical excision of the abscess is the treatment modality of choice from the start. Thank you very much for your attention.